Hi everyone, good morning. My name is John Muffoletto. I'm a general surgeon and I've been in Anchorage, Alaska for over 21 years. I'm going to do something a little bit different today. I'm actually doing a video format for everyone to see. It would go out on my web page as well as my Facebook page. And I'm going to try to give some information to my patients and any new patients. Purpose of this is to let everyone know what my office is doing and how elective surgery is being conducted in Anchorage, Alaska. I also want to leave a little link for people on how to deal with COVID-19 virus in today's world. This link has been floating around a lot, so many of you may have it. I think it's very, very good. It helped me, even as a caregiver, on how to live with the virus within my own family safely. And I think that's important. It's a video that's conducted by an intensivist out of Cornell University in New York and has been dealing with COVID-19 for the last month, and that's all he has been seeing every day. I first want to thank everybody for those wonderful comments on Facebook. Really was very humbling to hear a lot of you, all those wonderful thank yous on the care that they received by myself over the years, either from themselves as patients or family members or friends. It's very confirming as a caregiver and a surgeon to hear all of that. So once again, thank you so much, and all the wonderful comments about my office staff as well. Number one, I want to talk about what my office policy is doing at this point. I am making myself available for patients that absolutely need me in my office. Those patients that I've done surgery on that need wound care, drains to be removed. Of course, I'll make myself available for everyone that absolutely needs to see me. Other than that, I'll be taking new patients by telemedicine. Basically, how we're doing that is you'll be receiving a link that looks something like this on your email, and that will take you to a virtual waiting room via doxy.me, which is the format that I'm using. And then when I click on that, we'll have a video conference. All this information at this point is via my office manager, Lindy Davis. And again, she can be reached anytime at 276-1046, which is the office number. Again, things are changing on a day-to-day, week-to-week basis. So any questions that everyone has, please call my office. We're obviously still open. I'm going to be putting things on my web page and Facebook page, things that are changing. So any forms that need to be done, we're going to try to do that all remotely, so people can fill that out, and then I can see information online through a secure site, and we're working that out as of this week, so that will be done as well. And again, my office manager will have all that information for everybody. My Facebook page, John Muffoletto, MD at Surgery Alaska. You know that because that's where all those wonderful comments were on. And my web page, muffolettoaksurgery.com. The Facebook takes you directly to this link that you can click on. This is a very informative site, and I'm trying to update that as well. Even this week, I have some new videos, robotic videos on there. People can watch new blogs that are coming out, and I'll be more active with that because all elective surgery at this point is put off So other than handling problems in the hospital, I have a little bit more time to address things via telemedicine and internet. Number two, how is elective surgery being handled in Anchorage? Well, basically, all electives are being put off. I like to see, again, new patients by telemedicine in my office because there's going to be a mad rush of elective surgeries to be performed when this COVID-19 pandemic settles down, which it will. So I have block time at certain hospitals and at Surgery Center of Anchorage, which I am involved in. So when we get people lined up, we can have everything all ready to go. So people won't have to wait an additional 3 to 6 months for their elective surgery. Semi-urgent surgery. So that is being handled at this point. If I feel that there's a patient that needs to be done, acute gallbladder attack, abdominal wall hernia or inguinal hernias that are painful, that need to be done. The hospitals have their own operating room team at this point that evaluates all surgeries that are put on the schedule, and they're comprised of anesthesiologists, surgeons, and doctors, and they'll make a decision after we put it on whether they think it's appropriate to do at this time. They'll contact me, we'll discuss it, and that turnover time's about 24 hours. And we'll make a decision at that point that we can do this semi-urgent surgery either at Providence, Alaska Regional Hospital, or Surgery Center of Anchorage. So not everything is shut down, but as you know, we're doing this process to make sure that we have everything available for those surgeons and doctors that need the protective equipment. We don't want to be taking any resources away from patients who truly need the ventilators and the care. And at this point, we also want to protect our patients. We don't want patients to be exposed to COVID-19, especially the elderly patients, unless it's absolutely a necessary surgery that needs to be done. I'm sure everyone understands that. It's a tough time, but it's amazing how everybody has been coming together and dealing with this problem. Not unexpected, given the people that we are. Last thing I want to talk about is a link for people to watch, like I told in the very beginning of the video. And again, this will be on my webpage and Facebook page, so you don't have to feverishly copy this down, but it's a Vimeo format. And this doctor talks about how to deal with COVID-19, and I know everybody is maybe COVID-19 fatigue as far as receiving information, but I think this is a good link and video to watch. It's 60 minutes. I think would be most helpful. Again, we're going to wind this video up. I'm going to be doing maybe more of these as the information changes. If you have any questions, go to my webpage link and please call my office. Tough times, but we will definitely get through this. We'll be stronger, no question. We'll be more prepared, and we will be more united. Everybody stay safe. Thanks again for your time.